seen an increase in COVID cases across the country. There's been a less substantial increase in hospitalizations and really stability or decline in COVID deaths. So I think this trend speaks to the fact that most Americans have some degree of immunity to COVID, either through vaccination, having had COVID, or both. Most isolates we're seeing in the United States are BA2 or BA2.12.1. These variants are highly contagious as our collective immunity is selecting out variants that are more easily transmitted, but our immunity is preventing severe disease in most people. We do continue to watch BA4 and BA5, which are variants that have been identified in other parts of the world, currently in Africa. They have the potential to evade our current immunity, so we'll have to watch those closely to see if those indeed come to the United States. We're currently caring for about 60 COVID patients in the hospital across our healthcare system. This is a combination of patients who are currently positive and patients who are still in our care and are recovering. That number has increased some over the last few weeks, but certainly is much lower than what we saw at our peaks in January. The vaccine is still proving to provide protection against hospitalizations or severe illness. Most patients we're seeing in the hospital are unvaccinated still or undervaccinated, meaning they've not yet received that first booster. We do continue to monitor hospitalizations and are also looking at the wastewater testing from the state of North Carolina to understand the COVID activity in our communities. They have a great website that gives you some of that information, not only the current activity in wastewater, but also the changes over the last couple of weeks. Really, case counts now have become somewhat unreliable because we believe people are not getting tested when they're ill, or they're testing at home, and hospitals are not able to capture that information on home testing. So while the numbers are up, as I mentioned, relative to what we saw in January, they remain low in comparison.